good-looking, healthy young man who was my patient in the intensive care unit. I didn't understand why he was my patient. 3 days later, he was dead. That was my first exposure to AIDS patients, and at the time we had no idea what AIDS was, how it was contracted, how it was spread.
I just picked up the gauze and the needle went into my hand and it went into my finger and it went in really deep.
We deal with a high acuity patient population. We're in the field, in the ambulances, we're constantly starting IVs.
I deal with extremely high-risk infants. When I go into a delivery room of a mother who may not have had any prenatal care, I have absolutely no idea whether or not I'm dealing with anything that would be HIV positive or hepatitis C.
And it's not just nurses, it's the people picking up the trash, it's the housekeepers making the bed, you know. Needles are left behind.
Healthcare workers on the front line were the first to identify the problem and make it a union issue.
That infection control really benefits everyone.
In the summer of 1983, SEIU member John Mehring wrote this letter to his local union. I would propose that Local 250 conduct an educational campaign to increase union members' awareness and understanding of AIDS. In response, Local 250 formed an AIDS education committee and helped SEIU write the first of many AIDS leaflets for healthcare workers. The CDC labeled this 1986 booklet the best available.
Before I was pregnant, I could take care of these patients without a lot of fear and with compassion.
Members participated in an extensive AIDS education campaign throughout the United States and Canada.
We have an obligation to teach our children about this infection if we do not want it to continue to spread. And I say to you who feel like your children are too good to get this virus, well, my mother felt the same way. It is very, very important that we educate our family and our loved ones, because this thing is not immune to anyone.
It's reported that over 1 million needle stick injuries occur each year, and that is just the tip of the iceberg, because most of us come into work and think that part of our job is getting stuck by a needle. And we want to dispel that myth. It is not part of the job.
SEIU members, like Ellen Dayton, are among the 2,000 healthcare workers stuck every day by unsafe needles.
And what's all the more devastating, Ellen says, is it's an accident that could have been prevented if only she'd been using a different needle, a safer needle.
What's so upsetting is that for the price of a postage stamp, for 32 cents, we could have safe needles. They're on the market, they're available, and it's simply that they're just not made accessible to healthcare workers.
Andrew Stern is the president of SEIU, the largest healthcare workers union in the country. He says hospitals don't use the safer needles for one reason.
It's greed, it's money, it's profits, and it's unconscionable.
I've been very proud of SEIU because they've stood up for so long on this issue. There's no organization other than labor unions, with the push of the nurses in the labor union, to make those things happen.
We spread the word and pressured the regulators.
About 1 million healthcare workers are accidentally stuck with needles each year, and increasing numbers contaminated with hepatitis B or the AIDS virus. Healthcare workers want the government to require safety regulations.
After years of intense efforts, the combined pressure of many unions convinced our national leaders to pass an enforceable blood-borne disease standard.
It allowed us to have consistent legislation for all workers who were at risk for being infected. It said that management had to provide protective equipment. I would suggest that it was one of the outstanding victories for the labor movement.
Since that regulation was won, the CDC reported that the number of cases of hepatitis B dropped from 17,000 per year to 400 per year, and the number of deaths fell to an undetectable level, all due to the effectiveness of the vaccine. But there are no vaccines for AIDS and hepatitis C, only prevention, which made the availability of safer needles all the more critical.
You cannot stick yourself with this needle.
When SEIU learned that safer needles were on the market, we met with the nation's safer needle experts, filed a citizen's petition to ban the use of conventional needles, and brought testimony before Congress.
That's just not acceptable. A Detroit hospital worker, Gwen Spruill, showed a congressional committee a pile of contaminated needles and surgery tools found in discarded blankets and sheets.
Employers most concerned it's about money. Bottom line, employees can be replaced.
When you have 85% of our hospitals not using the correct needles, immediately I say, well, obviously, if we do this on a federal level, innovation will have to come with it, because then the demand will be there.
At the time of my accident, I was working on a medical unit at San Francisco General Hospital.
We had our first incidence of a nurse who converted to AIDS. She stuck herself with a needle in the course of having to walk a long distance with an exposed needle to a box where she could dispose of it safely. We went through a process of a grievance. It took us going to the press to explain what was happening before there was really a complete change of attitude, and we won our grievance. And we won everything we wanted. We won the right to have safety devices for all healthcare workers. We won an ongoing needle stick prevention committee, which would investigate all technology coming onto the market.
A number of local unions have negotiated safer needles contract language, and others have filed OSHA complaints to address workplace safety.
Who are the people that are making decisions about the devices that we're going to use? And we need to get ourselves on those committees. We need to get the devices that are being looked at into healthcare worker hands so that the frontline user can critique the device.
But victories in a few individual hospitals are not enough to protect the thousands of healthcare workers in other facilities.
There were safe needles available when I got stuck. I was off-site at this small clinic, a clinic where everybody had to be HIV to be there. And there weren't safe needles there, which really speaks to the fact that we need to make sure that the unsafe needles are not available.
Hey, hey, ho, ho! Needle sticks have got to go!
SEIU members in California realized that to get safer needles into more hospitals, we needed to pass state laws.
Cost should not be a factor. Every healthcare worker in this country deserves a safe needle when it's available for you to use.
We also worked closely with reporters from the San Francisco Chronicle, who exposed the needle stick crisis and the foot dragging by the healthcare industry and conventional needle manufacturers. This shocking expose helped get the nation's first safer needle bill introduced into the California state legislature. Added pressure from SEIU members and community allies forced Governor Pete Wilson to finally sign the bill.
Beginning in August, all healthcare facilities in California will have to use needles with safety devices. And last month, Tennessee enacted a similar law. At least 17 other states are considering safe needle legislation.
In December 1998, on the heels of the California victory, President Stern announced a national campaign to pass needle stick legislation.
Healthcare workers across the district are at risk every day trying to provide care to their patients.
Working with our locals through their state councils, we won safer needle legislation in 16 other states, and the pressure built for a federal bill.
I do not think that without federal legislation that all workers in this country in the healthcare field will be adequately protected.
The Safer Needles Bill passed through both houses of Congress with unanimous support and was signed into law on November 6, 2000. Inspired by the foresight and wisdom of union members for nearly 20 years, SEIU led the effort to win safer needles for healthcare workers in workshops, in the streets, in the media, at the bargaining table, and in the legislature. It was a fight that came too late for some, but the struggle continues until all unsafe needles are off the market and out of our hands.
Fight for your life.